everyone. So, we are here today in the World Without Borders podcast to talk about a special issue that nobody in this world can be outside of the system, and it calls health system. So, we are going to discuss about a little bit about health system in Brazil, in Cameroon, South Africa, and the US, and also share our experiences inside those systems. So, let me introduce you, my friends, Megan and Suzy. So, Megan, can you start, please, introducing yourself?
Thanks, Renata. Hi, everyone. Hello to everyone tuning in to join us for this podcast. Looking forward to spending this time with you and looking forward to hosting with you guys. Thanks, Renata and Suzy.
Awesome, thank you. Now, Suzy, please.
Hello, everyone. I'm Suzy. I'm from Cameroon, but I'm hosting with you guys from Kentucky. And it's a pleasure to be with you always.
Yeah, and my name is Renata Anderson. I am originally from Brazil, and I live today in Portland, Oregon, in the US. So, we are going to start asking questions to understand better. Um, just to let people know, my background is the healthcare. I worked all my life in health systems, and so it's very um, it's a topic that really touched my heart because it's how I dedicated my life. And I'm going to start asking Megan if she can explain a little bit about how is the health system in South Africa for us.
Renata, thank you very much. And like I suppose in many places there are tiers of health systems. So we have your typical medical aid systems, which is like your private healthcare, and we have your public health systems, which are extensive and very, very heavily burdened in South Africa. And I know, I mean, Suzy would probably be able to relate to this and many other countries that are not perhaps as advanced in the system, the medical system, but we've got quite a few options around medical aids and who you want to join up with. And a lot of our workplaces have an option to sign up for medical aid as part of the work group, right? It's expensive though. And unfortunately, a large part of our population here can't afford it. And we've just very recently, after our last elections in South Africa last year, we've got a split government, which means there are multiple political parties that have had to come together and actually govern our country. So that is a really new space for South Africa, and along with that came a totally new health system proposed by the government, which a lot of people are not happy with at this point. So there's a lot to discuss and unpack in this space.
Oh, thank you for sharing. So, one thing that we have in common, I think, in every country is the complexity. So, it's
Yes,
never a simple thing when we talk about a health system. It's
right.
always very complex, and it's really hard to give people access. And we know that that's what kills people. No,
Right.
it's sometimes in majority, it's not the disease, but the lack of access in a good health system.
Yes.
And up until now, this is a reality in a lot of countries. Suzy, can you tell us a little bit about the health system in Cameroon and how does it works?
In Cameroon, it's a little bit like what Megan said. A lot of people don't have healthcare insurance unless they work for the government. In our sector, is the government that offer the healthcare insurance, and a lot of people take advantage of that to a certain level, because the government is covering most of the hospital bills. First of all, hospital bills are not as crazy as the US. They are not. The hospital bills are affordable to a certain level.
Mhm.
till you reach a certain limit where it's not more affordable. And back home, we pay for what we get. We don't get credit for it. If you can't afford it, you first of all wouldn't even go there.
Yeah.
So you go there because you can actually afford it. So, and we have like public hospitals which are cheaper, and then we have private hospital which are more expensive. So I think you have that leverage of what can I afford, and if you can afford none of them, people go to the home. They get drugs from the road and heal themselves, things like that. But healthcare, it varies a lot. Like in Cameroon, as I said, let me go back to that. Is that a lot of people, they don't go to the hospital.
Mm.
Mm.
It's surprising, but we don't go to the hospital for little pain. So maybe my head is hurting. I cannot feel this. I cannot feel. I have malaria. We don't even go to hospital for malaria. As
Mm.
important as dangerous as that can be, because it's a sickness we people frequently have, we take medicine ourselves from home, know that okay, if I have malaria, I have to take this medicine for 3 days or 4 days and then I'll be fine. So we rarely, if you see us going to the hospital, like for most people back home, is that we are dying, we don't know what is going on with us, then we go to the hospital and say, okay, actually I don't even know what is going on with me. I don't know what to take because I've taken everything and nothing is better. Then you see them going to the
Yes.
hospital. I think that's what a little bit increase the death rate sometimes, is because we slowly die at home before
Mm.
even going to seek for help. Because they a lot of people don't have the means to. I might be privileged that my family had the means to do certain things. In my family, first of all, two of my sister are nurses.
Mm.
So they already at home, they do the medication for you, they do the things for you, and you only have to go to the hospital if you need to be monitored. But even on my sister have a clinic, so if I feel bad, I'm just at her clinic. But it's not the case for a lot of people. So
Yeah.
that is how it goes home.
Wow, that's very interesting. Thank you for sharing that. Yeah, you see, it's always complex. It's not simple, and it's have a lot of things to work on it. And in Brazil, we have, we can say, two big systems. One we call universal health system. That means it's public, and it's, we cannot say it's free because it's paid for taxes, but
Yes.
everybody can have an access, even if you are a foreign or a tourist and you broke a
Yes.
bone, and you need a surgery or an exam, you are going to pay zero in Brazil for that. So this is, we call SUS, um, our healthcare system. And but inside of the system, we still have the private system with hospitals, labs, that work in a, in in a private system where people have to pay for it, with the system of insurance, and some companies pay for that,
Yes.
and some people pay for that. So it depends. Um, as you say, Suzy, yeah, people from the government, they have a great insurance for sure, and they go to the best hospitals. It depends on the level you are in the government, for sure. not,
Yes.
not everybody have the same privilege.
Mm.
And but I think a big problem in Brazil is because the access of healthcare is, it's so different from when we talk about geography. It depends if you are, for example, in Amazon, in the rainforest, from indigenous communities, the tribes. It I started to work with them in 2000, and for a lot of them, it was the first time I registered that they existed in the system, you know. So they were now connected in that time. So, like, people that are never going to die because they never was born, in the system as a
Yeah.
statistics.
Yes.
So this is, and in São Paulo, where I come from, it's almost impossible. If you born, you have a registry. Otherwise,
Yes.
it's very rare. So we have completely unbalanced offer of
Yes.
healthcare. That
Yes.
happens a lot. So if you are in a big city, it's much easier than the rural area. It's,
Yes.
it's very different. And from where I saw from Africa, it's the same. No, the capital have the
Yes.
biggest hospitals and universities, and all the system is. But in rural areas, the
There
challenge,
is no, there
yeah,
is
Yes.
no, there
where
is like
the challenge starts. No,
the rural areas. I think I don't know what you said. On the rural areas, we use what we call traditional medicine, what our forefathers used way before the chemical medicine came into place.
Yes.
And that is why they live long. I personally agree that the traditional medicine is the best. The
Yes.
chemical medicine, I feel like, is killing you slowly. They're not there to heal you, they're there to get money. It's like a process where you're slowly dying on the medication. And when
Yes.
with the traditional, I remember when I was young, I am not a person that falls sick all the time, but as soon as I remember, my father made us go to the village every summer so that we can get in contact with our roots, because we are from the city. We are living in this big house. We don't know a lot of things of how to go to the farm. That's not even a thing. How to even
Yes.
had like I called it hard light. I thought it was punishment all the time, that I have to go to the rural area to actually figure out certain things. And I remember we just went to my first experience. I was 11 years old, 12 years old, something like that, and I had to go to a rural area. I got sick the day I came to the day I left. For those 3 months I was sick all the time. Why? Because there's certain things, in the rural areas, the mud, the way they eat with their hands. Sometimes when we go to the farm, we eat with your hand. And I could not do the farm. I tried. My hands were just full of, like, how do they call it? Is this
The,
boils? I don't know.
the blisters.
Blisters everywhere. So I was banned from the farm. That was a study. Third, each time I was sick, compared to like the medicine they used to give me when I was home. Even my mother is a very traditional. She
Yes.
does a lot of traditional medicine for us. But like the medicine they gave me, it really strengthened me. I think I became strong after
Yes.
I took those medicine, and then the second time I went back to the village, I was stronger.
Yeah.
It's true, I didn't still go to the farm because I was banned from the farm, but I didn't get sick as much as I did the first time I went there. Like the running stomach, me vomiting for no reason, things like that. It suddenly just ended without actually taking the medication I used to take before, but just I know they just know the specific herbs to give you, how to grind it. I don't know where they learned that. They never, so most of them did not even go to school, but they have so much wisdom that we don't even have
Yes.
a clue of what they do have. So
Right.
I love traditional medicine. I'm for
Yeah.
it the whole time.
Yeah.
I'm so glad you share that, because I think this is the important thing when we talk about health. It's uh, how colonized in some way our health system was. And I understand that pretty well, because working with indigenous communities in Amazon and after that in Africa, that we have in our minds, there's a lack of access of healthcare, health system here. And then we say, wait a minute, these people live here for 14, 20,000 years.
Yes.
And
And
it's
how did
longer
they
than
survive
most of
it? And
us.
like, who are who here? And I was like, "Ugh, those numbers are expressive. And
Yes.
so what happened? So there's a knowledge here, when I first came to Amazon, I was 26. I just finished college, and I was like, oh, there's something going on here that nobody spoke about in college, and but it doesn't mean that it's not happening, and it's happening. I just don't have this knowledge. I don't understand. And some people can call that miracle. And I call miracle something that I don't know how it happens, but that's happening, but so I used to would love to hear about you, Megan. So the traditional medicine is strong in the roots of the citizens in Cape Town.
Renata, yes, yes and no. So we've got a very big mix of cultures and um, histories in South Africa. So a lot of our growing up. So, for example, my family wasn't very heavily inclined to do traditional medicines, but I'm not sure if you guys have the same thing. And this is something interesting. So, there's this range of what we call Dutch remedies, right? And this is traditional, it's commercial remedies that's available, but it's apparently not as chemically loaded as the tradition the medicines that we know in the Western medicines today. But there was sort of this thing about your traditional medicines, so your herbs and your roots and so on, using that in medicating someone. And then there was this range of Dutch medication. And in our culture, we called it Cape Colored, there was this thing about they all taste horrible. And our parents were the generation where they firmly believed in these things, right? And as children, we were too afraid to say my tummy's aching or I've got an earache because they would just grab this brown bottle of something, this purple bottle of something, and give you a spoonful, and that was it. And so we were even afraid to say we were feeling ill because they
Good.
tasted horrible.
They
They
do all
tasted
taste horrible.
they tasted horrible. So in our family, we were privileged enough to always have medical aid. My parents had jobs when they had access to medical aid, and so the family as well. But there was a very strong belief in these Dutch remedies, these traditional old remedies, and it comes from natural beginnings, right? And then you had the pure traditional medicines that people sometimes follow. So it's still like that today, where there are certain groups, normally the older generations, that try and keep the Dutch medications, the Dutch remedies alive, and also the older people that are living a more traditional life very much still stuck in the traditional medicines. And I, for one, have been on a journey previously, years ago, I think I was in my 20s, where I was only seeing a naturopath um, for allergies and that kind of thing. And I still firmly believe in that because I've got access to the public health system as I sit here, so I don't have medical aid, medical insurance at the moment. I go through the public health system and it's overburdened. It takes a long time to be processed into the system, to be treated in the system, and unfortunately, because of the logistics attached to it, the treatment is sometimes not ideal. However, I can say that we have got some of the best doctors, medical staff, support staff in that space in the public health system.
Mm.
I think the logistics around the system and the structure of the system is the problem more than the actual expertise in that space.
Thank you.
So I've had experiences of most of them, most of the systems available over the years. And the more I'm getting to a point where I am understanding how the natural approach really affects your day to day and how you can build it into your daily living, the more it makes sense to me. But it's taken a long time of exploring and being exposed to the different sectors of the health system that's gotten me to that point today. So I think a lot of people are now sitting in a space where they are really rethinking where they sit in that space because healthcare is generally really expensive or really hard to access. And then the traditional medication and methods sit sort of in the middle, where people have access to it perhaps, but they don't know it as well as they might know the Western medication, so, and the medical system. So
Yeah,
we
I think both of you bring something very important. How many people are in the middle? They don't know anything about traditional medicine anymore. They don't know what kind of teas, what kind of roots, whatever, they should do. And but at the same time, they still don't have access on the formal system.
yes,
So those people have nothing. and
yes,
and this is the reality about so many people. I remember I worked with indigenous, and then I worked with the riverines. So they are in the middle of indigenous and the city. and
yes,
and it's horrible because they don't know the traditions anymore, but it's still they don't live in the city, so they are still in the jungle. So it's like, wow. So that's how hard things can be. And that when it comes the NGOs, it's NGOs like everywhere. And because they when we say that when there's a lack of uh, health, so someone is going to come to provide, if it's possible. Not always is possible, but it's one of the biggest concern in for everybody. So
Yeah, I totally agree with you that the tradition is fading depending on where the people are situated. Like in the city back home, like where I'm from, in the capital city, it is not even fading, it is dying because like I don't know most of the tradition. My mother knows all of them. Like I really have to call her. She was like, okay, you take that garlic that you have, grind it like this, and put this
yes,
and mix this and drink it. And I was like, "Ah, this tastes nasty." She's like, better drink it. And so when I drink it, I was like, I'm fine. Why am I fine? I shouldn't be fine. Like I didn't take. And in me, naturally, when I feel a little bit of pain, I don't like taking drugs. I really do not. If you see me taking drugs, it means I have to or I'm dying.
yes,
That's when you see me taking it because I'm used to that culture of like either natural or you can or your body can recover from it. Like
yes,
sometimes when I menstrual pain, you want to take. I'm like my body can recover from that, and then your
right,
body goes back to that state. So my body still have the ability to fight the
yes,
James and fight it because I've trained how can I say I've left it to be able to fight those James and not always bringing in medicine to fight for me so that my antibodies die. So my antibodies are still very alive. I know that. That's one thing I know
that's
ev-
about my
awesome,
body.
that's
everything on
awesome.
you is very alive, Susie.
The antibodies I know about the antibodies are still very alive because I treat them. I let them do their job.
That's important, eh? That's important, Susie. I'm glad you brought that up. I went through a phase also when I was exploring the whole naturopath and homeopathic space for myself. I went through a phase where for about 2 or 3 years I took no antibiotics. And your Western doctors look at you and say, what do you mean you're not taking antibiotics? And I'm like, I don't want antibiotics, because I think that was the time that I latched onto this whole process of people abusing antibiotics and the ramifications that we face with irresponsible use of and irresponsible prescription of antibiotics. So for me, it was sort of a test of the system to see how things. And for more than 3 years, I went without antibiotics. I had doctors laughing at me in my face when I said I don't want antibiotics, right? So bringing up the topic that Suzy mentioned at the very beginning, that money making racket and, people, you feeling like people are being killed slowly and still paying for it. I fully agree because you know what? If you think carefully about it, and this is something that I love thinking about, I love doing research. I come from a research background, and although I've got a background in non invasive um, instrumentation and fields around medicine, I've always loved research in that space. I'm very, very interested in that. And the big thing for me is the more I'm looking at all of these angles into medicine and how we work with it today, it just makes so much sense to go back to the basics, right? Going back to the
I agree
traditional
with
stuff
you.
that worked, like Renata said, for thousands and thousands of years. The Amazonians, the people that practiced that and lived that life were so healthy. They lived for a long time and they lived a much healthier life on the baseline. And then we come in with our chemical medicines, and suddenly we've got like mutant outbreaks of this and of that. And it's just crazy. So for me, my thinking process at the moment is like, can we go back to the basics and to the simplicity of nature doing its thing and allowing our bodies, like Suzy said, to actually fight it. That thing where people don't let their children eat off the floor if something drops. You know what? We tease, I tease people about it, people, young kids. I'm like, you know what? When you see your child like grabbing a handful of sand and putting it in their mouth, we've all done that. And,
Yes, we
we
did
were
that.
there and we survived it. And
We
Yeah.
survived.
we need that. We need to build the immune system. So I've got little ones running around in the family, and if something falls on the floor, they tend to look at me and I go, 10-second rule, which means pick it up and eat it. Go ahead. I'm not watching. I'm not judging, right? And they look at me now because they understand that everybody else is going to scold them for it. But I'm going to say to them, 10-second rule, I'm turning a blind eye. You eat that thing off the floor. You know what? It's just,
I'm telling
it
you.
really is not
Yeah.
such a big deal. I'm one
I
of those. I believe
yeah,
in that.
I can't remember how much I've eaten. Worst it when you go to the farm. See, that was my best. I think that is when my antibodies really started working. When you go to the
Yeah.
farm and when you finish in the farm, see, I was banned from the farm, but I went before I was banned. I actually went, and so with our fingers, with our dirty fingers from the ground, we take the food, even if it's swallow or maybe it's fufu, something we have to eat with the hand. We take it and put it in our mouth, and we eat with no problems.
Absolutely.
And we
I
are not
remember
sick. And I was like, what
exactly,
is in this ground that doesn't make me sick? And in the
exactly.
city, my mother would shout, but if maybe my thing fall on
Yeah.
it, I pick it, I eat it. And then I go
Yes.
back home. I was like, no, no comment.
Yeah.
Nothing.
Yeah.
So
Combined with the fresh air, I think, Susie, sorry, Renata, combined with the fresh air out in the country and,
I'm
just
telling
running around
you.
like kids do, our body's telling us something. That's what we need. We need to be out in the fresh air. We need to be active. We need to be running around. And we need not to be stressing about those little things.
Do
I
you
think
did you
that's
also
the
do
message.
that? Like back in the rural area when I was on holidays, we used to go and bathe in the river. We don't bathe at home. We go to the river to shower. I thought it was
Listen,
crazy the first time I did it. I was like, this is just so crazy. How can you shower? And then I loved it every time. I just run to the river. I was like, I'm showering in the river.
wow.
Susie, it's, it's,
I think this episode is so we have to continue in another time because
we do. We
so many
do.
things when we talk
I'm
about
telling
health
you.
because it's all our life. It's like how we take care of our health, and then how
Yes.
we take care about when we are sick. It's a different thing. No, so and we normally say this the health system, but it's the disease system, you know. So it treat disease. It's not the system doesn't want it looks like it doesn't want us to be health. And
Yeah.
so I think that's the discussion we have to continue. And as you talk about research, just to share some statistics. So there are a lot of research saying that we spend more money in healthcare in the last 30 days of our lives comparing. It's more than every money we spend in our life. It's in the 30 last days. So
Wow.
this is a very interesting statistics, no? Yeah. And because people more and more they die in hospitals. So I think that's a lot of healthcare. It never ends. It's an open discussion. So, but for the time we have, I need to finish our episode today here. So I would love for you to share, yeah, if you like it, comment, say how is healthcare in your country, in your city, what was your experience, and please subscribe. Thank you all and stay with us. Thank you. Thank you, Megan, and thank you, Suzy.
We're crossing oceans, crossing skies, lifting each other as we rise. No more limits, no more walls. Together we answer the world's calls. World without borders, we are free, telling the stories of humanity. No more divide, we stand as one. Together, together, our journey's begun.